Brittany. My name's Sam. I'm going to be your nurse today. Is it okay if I assess you really quick?
Yeah, that's fine.
Okay. Well, so I just want to let everybody know a few things. I've phoned in. I provided the patient with privacy. I've gathered all of my equipment. I've assessed her briefly. No obvious deformities. I saw her walk in the hallway. Her gait is steady. Her range of motion in her lower extremities is good. No involuntary movements. I can tell her hygiene just by looking at her. Her clothing is appropriate for the weather outside. She's clean, she's not disheveled, and her skin color, I'll note it throughout the whole assessment, but I can see now that there's really no obvious patches or anything abnormal with her skin. So I'm just going to look at your hands really quick, Brittany, and I'm just going to look at her nail beds. They're pink. She has good cap refill on both hands. Her skin's warm and dry. Her nail beds are flat, so that's what we want to see. Can you flip your hands up? So she has good range of motion in her hands. And then that's it for those. And then, so I'm just going to kind of look at her, how she's positioned. She's sitting up straight. Her affect and her mood are congruent. Her facial expressions and her body language is both relaxed, the same. Her speech is clear. She can hear me when I'm speaking, so she can hear the normal voice tones. And she looks well nourished. So I'm going to start with your head. I'm just going to kind of look at your scalp. And I'm just going to look for any like lesions, make sure there's no excessive dryness, and I'm going to kind of feel for any bumps. And then I'm going to kind of feel your skull, make sure everything's aligned right, no soft spots. Okay, and then I'm just going to feel your temporal pulse on that side and then this side, so they're both strong. And then I'm going to kind of press on your nose. Is that hurting or anything?
No.
Okay, good. And then can you open your mouth so I can feel her joint? It's fluid motion. There's no clicking or anything like that. So then I'm going to look at your eyes. I'm just going to have you look at me, and I can see everything, and her pupils are constricting when I shine the light in both eyes, and I can see that her sclera is white. There's no redness, nothing like that, no watering. I can see all the structures, and I'm just going to pull down your lower lid, and that's pink. There's no excessive watering. The conjunctiva is good. So then I'm going to test your peripheral vision. So can you just tell me when you see my fingers?
See it.
Oh, wow.
See them.
Okay, good. And then I'm going to test your accommodation. So if you just look at my pen light and then pick a spot behind me.
Just in the spot?
Yep. And then look back at my pen. Okay, so her pupils constricted when she looked back, so that's good. And so then I'm going to move on to her ears. So I'm going to come on to this side, and I'm just going to pull her pinna back a little bit with the scope. I would kind of put it right in the ear canal, and I would be able to see from that her internal ear structures, so her tympanic membrane, making sure there's no excessive drainage or anything like that. And I would also do that on the other side. So I'm going to whisper 3 words, and you're going to just repeat them back to me, okay?
Dog, cat, horse.
Okay, so she can hear me whispering, which is good, and I would also do that on the other side as well. So then I'm just going to move on to her nose and kind of just looking at her whole face. It's symmetrical. Her eyebrows, her eyes, they're all symmetrical. There's no real drainage in her nose. Can you look up? And I would kind of look up into her nose, just looking at the mucosa and everything, making sure there's no lesions. So that is good. And so then I'm just going to move on to her mouth. So can you open your mouth for me? You got a little mouth. And her teeth are white, they're straight, her gums are pink. I don't see any lesions. Can you stick your tongue out? Okay, and she said ah, so I can see her uvula vibrate, so that's good. And then can you look up? And I can see her hard palate, there's the rugae, and then her soft palate is smooth, so that's what we want. Can you stick your tongue out again for me? And I can kind of see down at her tonsils. I would probably say they're like a 1+. They're not inflamed. You can close your mouth. They're not inflamed or anything, so that's good. So now I'm just going to assess her neck. And I'm just going to, sorry, my hands are cold. I'm going to just kind of feel around her neck for the lymph nodes. Just tell me if they're tender.
Nope.
No pain or anything. Okay, that's
No.
good. All right, and then I can see her shoulders are aligned correctly. Can you just push on my hand, lean to the side, and then the other side? Yeah, that's good. So her neck muscles are strong enough, and can you turn your head to the left, and then all right. So that's good, and then up and down. So she has full range of motion in her neck, and then I'm going to feel her carotid pulses. Okay, so they're strong, I can feel them. And then if you want to look straight, I'm going to come behind you a little bit and feel her trachea and kind of move it to the side, make sure I can feel them. Okay, so that's good. And then I'm going to look at her chest. I can see that it's flat, so that's good. Do you feel any pain?
No.
Nothing? Okay, that's good. And then I'm just going to kind of percuss a little bit, and it's a hollow sound, so that's what we want. Okay, and then I'm going to listen to your lungs. So if you want to just take a deep breath. And another. I'm going to listen up here too. Down to the fourth. Okay, so her breath sounds are all clear, so there's nothing abnormal there. And her expansion is symmetrical, so that's also good. Then I'm going to have you kind of turn to the back a little bit. And so I would also listen to her breaths on the back because that is really the best way to listen. They're the most audible there. So I would listen at T1, which is right above the scapula, and then T3, which is at the top of the scapula, and then down by the apex of the scapula is T7, and then lateral to the vertebral line at T9, and then also on the posterior axillary lines at T9. So those are really important to listen to, and I would listen to them bilaterally just like I did on the front. So you can turn back around. And that's it with the chest, so we'll move on to the heart. So I'm just going to listen. I'm going to listen with both the bell and diaphragm of my stethoscope. And then I'm going to listen for the apical pulse for a full minute. Okay, so her apical pulse was 76, and it was regular everywhere that I listened, so that's good. And one thing that I need to mention for the eyes, I won't demonstrate it, but the Snellen chart, how I would have had her do that would be to have her stand 20 feet away from the chart, and then I would have her cover one eye, and then I would have her read the lowest line that she could, and that number across from that line would be over 20, and that would be her visual acuity for distance. And then obviously you would do the other eye too because they can be different. And then also you could do the cover test, which would be her holding a piece of paper, which is kind of a mini version of the Snellen test. So that's just testing your farsightedness. So then that would kind of be the same thing with that. And that concludes my assessment.